Hello, I'm Dr. Joel Becker, founder and director of the Cognitive Behavior Therapy Institute and director of Cognitive Behavior Associates here in Beverly Hills, California. This is another in our series of helpful and informative videos about cognitive behavior therapy and various psychological disorders. Today we're going to talk about depression. Depression is a very serious disorder that affects over 18 million Americans. Typical symptoms of depression include sadness, tearfulness, fatigue, inability to enjoy things, changes in weight, problems in sleeping, decrease in sexual energy, and may even evolve to thoughts of suicide. There have been two treatments that have been shown to be effective for depression. Generally, those are thought of as medication and psychotherapy. The particular type of psychotherapy that has been shown to be most effective is cognitive behavioral therapy. I want to tell you a little bit about what is typically in a cognitive behavior therapy treatment so that you'll know what to be looking for. Number one, our oldest and often our first approach in working with a person who's depressed goes by the name behavioral activation. What this fancy name means is that by the time we see a depressed patient or client, what we see is that they are typically no longer engaging in activities that either used to give them pleasure and or mastery. So what we do in the beginning of phases of treatment is we counsel them back into those activities to increase pleasure and mastery, which often result in decreases in depression. A second common component in a cognitive behavioral understanding or treatment for depression is to look at it from an interpersonal or social point of view. What I mean by this is, again, that by the time we see a patient and the depression is present, that depression is somehow functional in their system. Their social system is interacting with them in a way that is either reinforcing the depression or somehow resulting in the depression working for them. What we try to do is to untangle that interaction so that depression is no longer necessary in the system. A third component of cognitive behavior therapy for depression is the cognitive therapy itself. Cognitive is a synonym for thought. What we've learned over the years is that depressed patients have come to think in ways that are faulty or not helpful for them. What we do is we help people to look at the ways they're thinking and then to learn to think in other ways, or even to, using a way of saying it, to try on other ways of thinking and see how those affect their mood. Still, a fourth typical component of cognitive behavioral therapy for depression is referred to as an assertiveness component. Assertion is a skill that involves being able to express your rights, your wants, your wishes, your goals toward other people. If people lack in this skill, we often see depression. Research studies have shown this over a strong number of years. If in fact we identify an assertiveness difficulty, then assertion training may very well also be part of the treatment. What I've described would be a generic description of a cognitive behavioral treatment package. Of course, each patient needs to be assessed individually and their treatment designed to address what would be most prioritous in their situation. For more information about depression and the cognitive behavioral treatment, please visit our website, cognitivebehaviораssociates.com, where you can click individual treatment and then depression to read more and access other helpful links. Thank you very much.